Trying to fix the healthcare crisis with all the wrong solutions. Hi, I'm Brian Lilley, political columnist with the Toronto Sun. We have a healthcare staffing crisis in Canada. In fact, it's a global healthcare staffing crisis. You can just ask the World Health Organization about that. Canada's not the worst off, but we are in a bad spot. Lack of doctors, specifically a lack of nurses, making the system difficult to operate. But some of the suggestions on how to fix this are downright batty, including giving the federal government the ability to license doctors or nurses to practice in provinces. Why? Well, apparently the idea is we want to bring in more doctors and nurses, and the federal government, well, they're in charge of immigration. So let them license them as well. Let me explain to you why that's a bad idea. Currently, the federal government has a 4-year wait time to process an application for someone who's a skilled tradesperson. We're talking plumbers, carpenters, bricklayers, the type of people that we need to build all kinds of infrastructure across the country. 4 years. Who would wait 4 years just to have their application processed? And that's the group of people you want to put in charge of deciding how many doctors come in, whether they get approved. They have no ability to do this, and they're not even good at doing what they are tasked with currently. Look at the lineups at the passport offices, the lineups at customs, in airports across the country. This is a horrible idea, but then again, so are most of the others. It seems that when it comes to healthcare in Canada, we have two options: keep doing the dumb ideas that got us into this bad situation in the first place, or just scream that any attempt at innovation is American style healthcare. Look, we've had a healthcare staffing crisis for decades now. Honestly, decades. And every summer, there is a staffing crisis. This year, it's being exacerbated by too many people going on vacation at once. That's a decision made by very well-paid managers who perhaps should be fired. But also, it's exacerbated this year by COVID and the seventh wave it swept through in July and August, and procedures that are still in place requiring people to take extended time off even if they've been exposed to someone and they're testing negative. That's not something we do anywhere else. I get that we want to be careful because it's a hospital we're talking about, but this is also a time of crisis. Having people sit at home because they met someone who had COVID isn't the way we should be operating in 2022. It's not March 2020 anymore. We know better, or at least we should. The only solutions being brought forward, though, are the same old, brought to you by associations and unions and organizations that are paid very well to lobby government and have been having the government's ear for decades. They're the ones that got us into this situation. I don't think they're the ones to get us out. We need to be innovative. We need to look at how other single-payer systems, be it the United Kingdom, France, Germany, how other countries deal with this, and not look at any attempt at innovation as the importation of American-style healthcare. We need to be grown-ups about this. I'm just worried that that's not something most Canadians are willing or prepared to do. It's definitely not something Canada's media are prepared to do. Let me know what you think. Drop a comment down below. Share this on social media, and don't forget to subscribe to our channel.